Today we have Dr. S.R. Narahari, the Founder-Director of Institute of Applied Dermatology in Kasaragod. He is one of the pioneers in integrated medicine. After years of scientific research, he has come out with an integrated medicine for treating lymphatic filariasis and lymphedema, one of the most neglected tropical diseases in the country and of course in the world. So we have Dr. Narahari with us. So we will be exploring how the integrated medicine has revolutionized the treatment of lymphatic filariasis and lymphedema. Good morning, doctor.
One.
What prompted you actually to develop an integrated medicine for treating lymphedema and lymphatic filariasis?
I have been a very typical modern medicine doctor, saying that in the medical colleges they would say anybody coming with the LAPM applied, or they say Ayurveda, all the entire gang of doctors sitting there would pounce upon the patient, say, why did you go there?
Modern medicine doctors are against Ayurveda.
Against Ayurveda.
Okay.
So that's the environment where I studied. And I settled in Kerala for practice, and same mentality.
Okay.
I had the same mentality. But Kerala patients are different. That time, 30 years ago, I mean, I've been practicing doctor 35 years now. I would also say that patients, when come with, they have taken the other treatments. First line treatment as Ayurveda, and then come to allopathy as a second line treatment. I would also talk to them in the same tune as I studied in the medical college as a young doctor.
Okay.
And quickly realized that as we prescribe more and more drugs of allopathy, we encounter more and more side effects.
Okay.
It's only as long you prescribe a drug long, then you're likely to know the full story of the drug.
Okay.
If we are prescribing the drug as an acute condition, as happens in the medical colleges, because medical colleges because it's a tertiary level care. Medical colleges are tertiary level care. All patients don't come for follow-up at that time to the medical colleges. So they come for the consultation, diagnosis, initial acute treatment, then they follow up with the local doctor.
Okay.
So the follow-up of the patient for a long term in a medical college option is less.
Okay.
So as a medical student and a doctor, PG doctor, we see less of a side effect of the drugs because our exposure to the patient is much lesser.
Okay.
In practice, patients get attached to the doctor, and they continue to be with us for a long time.
Okay.
So as long as they are long time, and then they take the drugs for a long time, we prescribe the drugs for a long time and for more patients.
Okay.
Statistically also, we are likely to encounter more side effects. So we knew that I knew that our system is not holistic.
Allopathy system is not holistic.
Allopathy system is not answer for all diseases.
Okay.
This is the first experience I got in my practice in initial 2-3 years.
Okay.
Second thing I realized is that the patients would, whenever we make fun of them for going to Ayurveda, they won't say anything because they come with acute exacerbation of the disease.
Okay.
So they come with a guilt. But they will say that for the next consultation, or they come for a different disease, then if I had inquired them of what happened to your previous disease, then they will say that your treatment did not cure this.
Okay.
I went another couple of doctors in allopathy. There also I did not get a relief.
Okay.
Now it is okay. I have a best relief. Because I am taking in a traditional medicine system, an Ayurveda system.
Okay.
Or some other system of medicine which is not allopathy. But I'm happy.
Okay.
So this repeatedly I started hearing.
Okay.
So I thought there's something more in other systems of medicine.
Okay.
And I started correlating that in my pharmacology days, I came to know that from the times of Osler, or even before that, allopathy evolved from the traditional medicine. They all took the medicine from all systems.
Okay.
But they named it as allopathy or modern medicine.
Okay.
And developed their own system, our own system, which is scientific. They developed the tools, they made it very structured way of treating.
Okay.
And they found success.
Okay.
Acute care, yes. Allopathy is very good.
Okay.
Chronic care, eventually I realized that there are a lot of limitations for allopathy, and there are many answers in other systems of medicine. So this is how I got attracted to other systems of medicine.
So why did you choose lymphedema and lymphatic failures? Basically lymphedema.
When these thoughts came to me, I started my practice in 1990, and in 4 years, I got to know the full limitations of my science of allopathy.
Okay.
I realized that it's good, but it is not all. Some of the side effects of the medicines which I saw, I happened to report them in the journals, and happened to be the first or second case reports in the country or in the world. And then I realized that I need to know more about the chronic diseases.
Okay.
Because there must be ways, if allopathy ends there, I explored in Ayurveda, and there were many patients, many Ayurveda doctors in the periphery in Kasaragod who would refer their patients to me. So I had a habit of, even now also, I have a habit of writing a reply letter to all doctors who refer a patient to me. Whoever refers a patient to me, I send a reply letter. So I say that why I made this diagnosis, what is the line of treatment, and how it has to be treated.
Okay.
So I would write a letter, which even I do it now. So there was an interaction between the local doctors. They would say that doctor, this is not the only disease Ayurveda can treat. It can treat other diseases.
Okay.
So they started naming few diseases.
Okay.
Which it is possible, they said, to treat.
Okay.
So then I got an idea of why not use that system, why not use this system together.
Okay.
So I started exploring.
Okay.
There was no medical library here. There's no internet. I thought there is a Central Institute CPCRI here.
Okay.
So I went to that director and requested, can I visit the library? I saw that they had some other biological journals. I was a bit surprised, but I started using it. I gathered that there are other diseases which can be treated. So I started meeting many experts like JIPMA, like KM in Mumbai, and then Kottayam Medical College.
Okay.
Professor Lakshmi Nair in Calicut Medical College. Of course, she was my teacher also. So these are some of the very balanced, senior, established, highly renowned academicians. I started writing letters to them.
Okay.
And they very gracefully replied me.
Okay.
And then I started discussing with them. And then they encouraged that you should focus only on 1 or 2 diseases rather than going everything. So, but nobody had an idea of how to go about with integrated medicine, which disease we can take. Nothing was there. So I started attending Ayurveda conferences. Very little were there. Very little. That time there were no Ayurveda conferences. So I attended almost all dermatology conferences and started discussing. Of course, they were gracious because the old-time dermatology practitioners, they never hated Ayurveda.
Okay.
That I should say. Like, for example, late Professor Gopinathan from Calicut.
Okay.
Late Professor Sugatan from Calicut.
Okay.
These are the people, I was a boy from them, and then of course Sugatan was my examiner, Professor Lakshmi Nair was my examiner. So they knew that this boy is doing something.
Okay.
So they realized that as clinician, this is good for the society, they realized, for a patient.
Okay.
So they tried to encourage me, even if I spoke Ayurveda in the conferences.
Okay.
So they...
Allopathy conferences, you used
I
to speak
started.
about Ayurveda.
So probably they would speak to their contemporary people, don't shout at him.
Okay.
He is doing something, let him speak for 5 minutes.
Okay.
Probably that kind of attitude they would have taken.
Okay.
So that opportunity the senior Kerala doctors gave me.
Okay.
That encouraged me as a young doctor, encouraged me so much.
Okay.
But all of them gave me advice that you need to narrow down your focus.
Okay.
But nobody had any interest in Ayurveda.
Okay.
Except Shardini Dhanuka, who also late Shard, who died in 2005. She said, because she was interested in Ayurveda, she said, you need to focus. Then in world, so finally I attended the first World Ayurveda Congress in Cochin.
Okay.
I met Professor Terence Rayon.
Okay. From Oxford University.
Oxford University, who was actually the alternative system medicine,
Okay.
which was coined. actually was first popularized in the Western world by Professor Terence, if I am correct.
Okay.
I may be subject, I may not be right. He started a organization called Gifts of Health.
Okay.
You see, the word is so beautiful. Gifts of Health. So the expansion is global initiatives for traditional systems of health. Gifts.
Okay.
Global initiative for traditional systems, gifts
Okay.
of health. He said the traditional systems are the gifts
Okay.
given for health system of the modern medicine. That was his thought.
Okay.
So along with the one non-doctor, non-medical doctor, policymaker, Professor Gerard Bodeka was there.
Okay.
He wanted to do something for alternative system medicine, but he had no platform because nobody. So he started this organization with Professor Terence Ryan. So Professor Terence Ryan was the head of the Department of Oxford,
Okay.
and he said, "Okay, if it is helping dermatology, I will give you a space."
Okay.
So within the dermatology department, he gave a small space. You can now call in the modern terminology virtual space.
Okay. Okay. Okay.
You can say that, but that was affiliation given.
Okay. Okay.
Of the Oxford affiliation was given. That is how it started. So this is how Professor Terence Ryan got interest because he knew. So then what happened is Bodeka knew a couple of agriculture scientists in UK.
Okay.
One of them was late Dr. K.K.S. Bhatt,
Okay.
an Indian,
In India.
but he is native of Kasaragod.
Okay.
He had shown some interest in medicine plants.
Okay.
So, and then he used to supply some information on medicine plants to Professor Terence Ryan through Bodeka.
Okay.
So, he was in the meetings of Gifts of Health in Oxford. When he came to Kasaragod, he knew me as a doctor. And then he knew me also because he was very distantly related to me. And then we had about 1 hour chat. And he recommended that if you are going to India, to Kerala, try to meet Dr. Narahari. He is interested in traditional medicine. He's a modern medicine doctor.
Okay.
So this background he had
Okay. Okay.
when he came to Cochin.
Okay.
So I was going to from one session to other session, and then I found that Professor Ryan was interested in, and then I spoke to him.
Okay.
Then he immediately connected what Dr. K.K.S. Bhatt told.
Okay. Okay.
So our meeting lasted initially about 2 hours.
Okay.
Then he started guiding me, saying that if you are looking at integrated medicine, I think lymphedema is one place where you can focus because the advancement in the pathophysiology of lymphedema is ripe to use any other systems of medicine because we all know how lymphedema is formed.
Okay.
We all know how the mechanism of lymphedema is there. Allopathy very clearly knows how the disease is formed.
Okay.
But allopathy doesn't know how to reverse it. If you look at chronic diseases of many which have very little treatment, he told me that allopathy at that time was not advanced enough to know exactly how the disease is formed. But lymphedema, allopathy knows how the disease is formed. So it would be useful for you if you try lymphedema.
Okay. Oh, that's how you zeroed in on lymphedema.
Yes, Professor Ryan, who was actually had a very clear thoughts on how to take forward the disease of lymphedema. So I found a mentor in him.
So you started your scientific research on integrated medicine for lymphedema in 1999, right?
Correct.
So how many years of effort you put in to develop? You have to develop proper system that this kind of integrated approach can deliver you results.
It took about 6 years.
6 years.
6 years.
So 6 years of research, patient data. So all these huge data you put together, and you finally, after 6 years of hard work, you derived at a end result that this particular type of protocol can give you results.
We should consider the time period between 1994 2005.
Okay.
Where we had a lot of thoughts developing, discussion going on.
Okay. Okay.
Discussion going on, and then reading. All that preparations happened over 10 years.
Over 10 years, okay.
But that got a very narrow, structured focus in 3-4 years.
Okay.
I made the first presentation about the success story of lymphedema in 2003 in Germany.
Yeah, okay.
That was a conference of lymphology,
Okay.
where I said, if we take an approach for lymphedema like this, we are likely to get a very sure treatment success protocol in 2003.
Okay.
So that was a big debate in Germany about when I presented that, and the discussion went on more than 30 minutes on a 10-minute paper.
Okay. Okay.
So it's very unusual for a Western country.
Okay.
So after that, I developed the process, and we made a first conference on lymphatic filariasis treatment in CPCRI here, held in 2005, where we presented the data of 55 patients.
Okay.
That is the point, I would say, that where we launched the protocol.
Okay. So how many patients have been treated since then? How many patients you have treated?
I will say that about 7,500 patients have been.
7,000 patients you have successfully treated.
Yes,
As of-
yes.
So in earlier discussions we had, you said that lymphedema is like, it's a lifelong disease. So like a BP patient taking BP tablet, it's a continuous treatment process. So is lymphedema, your treatment process is that the patient needs to continuously undergo his self-medicare or something like that to keep things under control?
Yes, correct. The system has its own complexities.
Okay.
So then, to make anything a clear positive statement very boldly,
Okay.
it has to pass through a lot of system.
Okay.
Be it be in bureaucracy, or be it be in science, or be it be in any system.
Okay.
So in the same way, now we have developed a healthcare system which is very complex.
Okay.
People now talk about evidence-based system medicine. People say that even in Ayurveda, they say good manufacturing practices. So there are a lot of parameters are put forward to say that a disease is under control,
Okay.
or a disease is cured.
Okay. Okay.
In this context, in this background, to say that one disease is cured is almost impossible for a doctor, because it has to pass through so many systems. And then we need to follow up a patient for 15 years to say that the disease is cured or not.
Okay.
While the commercial part of the disease, commercial part of any business, including health, will modify these definitions.
Okay.
They will say that cancer is cured if there is no recurrence in cancer in 5 years. You see, these kinds of discrimination
they keep on changing
the system. So to tell whether lymphedema is cured or not, clear definition is not possible.
So we can plainly say we improve the quality of the life of the patient.
We can say that, therefore, lymphedema is totally treatable,
Totally treatable.
and the patient can lead near normal life.
So we can successfully treat.
We can successfully treat.
The Ministry of Ayush has adopted IAD's integrated treatment protocol as a public health program, right? So it's a big achievement for IAD.
Yes, I mean, if you look at the NAM guidelines,
Okay.
it has written that lymphatic filariasis under the LFMMDP program, which is a national program, this treatment can be used. They have very specifically mentioned in the document name of the Institute of Applied Dermatology and its protocol.
You are partnered with BMGF to offer treatment to patients across India. So how did that project take off actually?
The Bill and Melinda Gates Foundation, they are committed to many things.
Okay.
In that, lymphatic filariasis program is also one of them. So they have been supporting the logistics and patient education programs for the elimination program of lymphatic filariasis. That is, it's called Master Drug Administration, which is launched by WHO. The elimination program includes treatment.
Okay.
So they decided that they have to also treat the patients of lymphatic filariasis. Without treating the patients, it's not complete. So globally, as a first program, they thought of starting a treatment for lymphedema. So they were exploring which is the best treatment possible, which can be used in the public health mode. So they probably zeroed in on our treatment, and they approached us from their New Delhi office, and they came here and they saw, and then there was a very long process of evaluation, and of course they decided on the evidence for the treatment based on our scientific publications.
Okay.
So that's how they decided to fund this program.
Okay. And even I think British Journal of Dermatology has published the treatment protocol.
Yes,
Right? That's
yes.
a big recognition also after.
Of course, that because it has come on a cover page of BJD. So I think that is probably the culmination of the best possible evidence publication.
What are the other treatment options which are most opted by the patients? Like surgeries are there for lymphedema treatment, and other treatment protocols are there.
I must say that our integrative medicine is treatment is surgery free. We say it's surgery free treatment. Surgery, which includes recently liposuction, then the debulking surgery, which is very huge limbs of more than 20 liters, 30 liters. They remove the excess tissue and do the surgery. They try to connect the lymph nodes with vein called nodovenous shunt and things like that. There are multiple surgical treatment, lymph node transfer and so on. But in our study, which we published in the British Journal of Dermatology, we also dealt on the 10-year follow-up study. We said, what are the factors which progress the lymphedema? In fact, the factors which scientifically say that these are the things which make the disease progress, increase. In that, surgery came as one of the important factor which worsens the disease.
So you're saying that surgery worsens the disease?
This we published.
Okay.
16% of our patients are the patients who have had surgery and got the disease worsened and then came here for relief and got relief.
Okay, so you're saying that patients come to IAD for integrated treatments after undergoing all of the treatments available in the market. That includes surgery.
Yes, I mean, not necessarily. When they are advised on surgery,
Okay.
most of them think many times before undergoing surgery nowadays.
Okay.
Then they start doing the YouTube searches,
Okay.
all internet searches, and they try and they find, and then they come here.
Okay.
But if you look at a 15 years backstory, those patients who undergone surgery and failed surgeries would come. But nowadays the trend has changed that when the surgery is advised, they start coming here.
Okay.
Of course, that's a popularity through the internet it has.
Okay.
But otherwise, we get 50% of patients or more who have tried all other sorts of treatment, then come here and get relief.
There are two types of lymphedema diseases, right? One is lymphatic failure. It's a parasitic disease. So across the world, this lymphatic failure is still a neglected tropical disease. There are a lot of patients out there in the world. So how do you plan, if integrated medicine is one of the best treatment options available, so how do you plan to take this treatment to that patients who don't have access to this treatment?
It's a difficult question to answer.
Yes.
I think you should ask this to a very big corporate body because it needs money to expand. But then within our limited resources, we are doing our possible things. Like this is important because we get patients from all over India. From 26 states we get patients here.
Okay.
And we get patients from 14 countries, including the US.
Okay.
We get patients, including the advanced nations, we get patients. Because they are not satisfied with their treatment and they say that why don't you start the treatment in their country? And they are allowed to take the Ayurveda treatments once or twice. Beyond that, their system doesn't allow that. Either that is thrown out in the customs or they are unable to take it to their place. So they have to discontinue the treatment. So to expand is a challenge because it's integrative system which has Ayurveda in it. Yoga became popular all over the world.
Okay.
So we already got more than 25 therapists from Europe who came here, learned yoga,
Okay.
and practice in their lymphedema clinics in Europe.
So I actually the integrated treatment protocol is combination of Ayurveda, yoga, and specific diet, right?
And allopathy.
And allopathy.
Allopathy, which has a compression bandage and few other treatments.
Few other treatments. Yes.
So in the expansion program, we worked with the government of India.
Okay.
We worked with the government of Bihar and the government of Uttar Pradesh.
Okay.
So we started 4 centers in North India, and we provided free treatment to hundreds of patients there the last 3 years. And then we did this treatment inside the government Ayurveda hospital.
Okay.
And we made our effort to transfer the knowledge to the government Ayurveda hospital. I hope this gets expanded to, at least in India, into other places.
Okay.
And to expand to other places in the world, it would require the major government support.
Why did you choose yoga actually?
The lymphedema treatment, according to the International Society of Lymphology, exercise is an important component for improving the patients of lymphedema.
Okay.
This is the scientific evidence. There are scientific evidence. So that's why we thought of adopting yoga, because second point which allopathic evidence shows is that to drain the lymph and to drain the venous blood from the lower end, breathing is important. So the exercise and the breathing and the movement of the muscles and the joints are important to push the venous and the lymphatic system from the leg towards the heart. This is the allopathy knowledge. The couple of exercises which recommended is the heel rising exercises,
Okay.
where gastrocnemius muscle, that is a calf muscle, is put into action.
Okay.
So we looked into yoga in that sequence. Then we saw that there are plenty of exercises which can actually sequentially move the muscles and joints in the body. And deep breathing is a part of yoga.
Okay. Okay.
So we thought, why not adopt yoga then go for, because doing a vigorous exercise is was not recommended at that time in 2000 for lymphedema. Now there are papers that vigorous exercise also help lymphedema, but not conclusively proved. So we took a middle path, and then we also knew that yoga can benefit. So that's how we adopted yoga, and then we did a lot of experiments so that patients can fold the limb. So we developed a sequence of yoga for lower limb lymphedema, how the yoga should be done, which will help the lymph to slowly move towards the abdomen and then towards the heart, and then can drain the lymph from the head towards the heart. So that sequence we developed and published. For upper limb lymphedema also we developed a similar sequence. Now we use the ICG machine, and we precisely know that the massage helps draining lymph. Gulfa Chakrasana, rotating movement of the ankle. We have seen that through ICG studies, the Gulfa Chakrasana is pushing the lymph forward. So we are slowly creating evidence that yoga drains the lymph.
Lymphedema is actually caused by parasitic infection, that's lymphatic filariasis. And so what about this breast cancer treatment? How this cancer treatment causes lymphedema?
The lymphatic system has a very important function. In addition to what it drains the lymph, it is an immune regulator of the body. So it's a defense system of the body. So the cancer cells, whenever the cancer is produced anywhere in the body, it is the lymph node which affects the first time. So the cancer cells move to the lymph node, and then from there it spreads to other parts of the body. So the treatment of the cancer involves, so for example in breast cancer lymphedema, if a clinician makes a diagnosis of a breast cancer, then the idea is that the lymphatics will drain into some lymph node in the axilla.
Okay. Okay.
Some lymph node in the axilla it has to drain. They have to remove the entire lymph nodes. When the lymph nodes are removed, the lymph which is coming from the hand, that gets blocked, the lymphedema sets in.
Okay. Okay.
So there are current technologies like sentinel lymph node biopsies are there, which prevents the previously mass dissection of lymph nodes used to be done. They will remove all the lymph nodes of the axilla, many of the lymph nodes in the axilla.
Okay.
So that used to cause major damage, and
So for the treatment, for the cancer treatment, it's mandatory to remove the lymph node.
yes, now the sentinel lymph node biopsy, that is, if they inject the ICG
Okay.
to the tumor, let us say, or surrounding the tumor, let's say, or there are other lymphocytography and all that techniques are there. If they can inject the dye to the tumor, if they are able to, tumor in the breast, they inject tumor around the tumor, and then this fluorescent dye will move.
Okay.
It'll move, and they are able to track it and to the particular lymph node where the dye is going and where it spreads.
Okay.
So using that technique, they are able to find out which are the lymph nodes are affected by the malignancy.
Okay.
They will only remove that lymph nodes now.
Okay.
Now.
Okay.
So that's a technology advance. The number of lymph nodes removed is much lesser. So the chances of lymphedema after breast cancer surgery is much lesser.
Okay.
But if the breast cancer is detected in much later stage, they have to remove more lymph nodes.
Okay.
So it leads on to the blockage of lymph drainage, and breast cancer can happen. It can happen, let's say, if this is called melanoma is there, and they have to remove the lymph node from the groin.
Okay.
Then the low limb lymphedema can happen. A very common disease in skin called hidradenitis suppurativa is there, where they get repeated infection of the lymph nodes here. Infection, simple infection. And untreated or poorly treated, and it can damage the entire lymph node. And then the related lymphedema can happen. So any damage to the lymph node, can it be from malignancy or removal due to surgery, or maybe tuberculosis, or repeated intravenous abuse of the drugs, that can cause damage to the lymph node. So any damage to the lymph node or the removal of the lymph node can lead to lymphedema as a malignant syndrome. Another cause for lymphedema would be if you go to Ethiopia, for example, in Africa, and if you go to maybe in surrounding countries, there is a volcano soil is there. The soil contains some minerals, and that can go to the lymph node and block the lymph node, and then the lymphedema can come. It's what's called podoconiosis.
How do you plan to take this treatment? Because there are a lot of patients who are still suffering from lymphedema. So, how do you plan to take this treatment, this wonderful treatment, to those people? Are you in discussion with governments? Is any institutions coming forward to support you in this regard?
Actually, I am very grateful to the government of Kerala and government of India for trying to help to take it to the mass. Both government of India and government of Kerala has recognized this. The India's integrated medicine policy came in 2017, but the Kerala government made a special government order to set up an integrated medicine center in IID way back in 2015.
Okay.
There was a special resolution in the Kerala Assembly to set up an integrated medicine center, and the order of the governor, it is passed and set up the integrated medicine center. So I'm very grateful to the government of Kerala for that. I think in India, we set up the first integrated medicine official center in this place, and budget allocated money for it, and we set up a research program for it. So later on, when the Department of Ayush, government of Kerala, they came here, and then they invited us for discussion. They have a plan to actually take it in the platform of, they have a teaching platform, the open teaching platform based on IT promotion platforms in the government. They asked us whether we are willing to be part of the government program so that it can be propagated to people, India and outside. So we said yes, and some negotiations going on. And they want to bring it under the NAM. And NAM, of course, we already discussed that it's recognized. Government of India recognized it. So they also tried to propagate it. They gave a permission for us to start the program in the central CCRAs, council hospitals. State governments in the UP and Bihar gave permission to start the treatment in Ayurveda medical colleges so that the students learn it. So these are very small, tiny efforts we are doing and working with government, try to expand. Government takes its own time to expand, and I hope it will succeed in one day.
When you look back at the patients who have successfully undergone treatment at IID, how their life changed?
I think you should see some of our YouTube videos where it shows you in live how their life has changed. But as a clinician, I see people coming here on the ambulance and walking back.
Okay.
I see people coming brought on stretcher and walking back. I see people telling me that I had to sell my house to get the treatment elsewhere. But here, for a small money, you treated me and I am working back. I have seen people having children again after treatment, opening their business again, going back to their jobs, doing the manual work again, giving head load workers once again. All this I have seen. All this I have seen. So on the scientific world, somewhere around 2009-10, Government of Kerala asked us to show the improvement of quality of life in lymphatic failures to treatment based on this treatment. So they gave us a research grant and asked us to prove whether your treatment really works in the field. So we did a community trial in Calicut district, Kasaragod and Allopathy district.
Okay.
We went to the PHCs and I think we went to about 550 houses and we recorded a quality of life change. We published that in Acta Tropica later. That we developed a questionnaire that we asked the patients what happened before the treatment and what happened after treatment. So that all that scientific details are there. It has to be pre-tested and tested. All those things are there, which we all did as scientific method, and then we tested and then we proved that it's useful. So that has an answer for, let's say, mobility, psychological. Those are the 7 quality of life domains are there. So those quality of life domains we checked. And then we proved that it works. So we developed a tool to assess on an evidence-based way whether our treatment changes the quality of life of patients.
Okay.
We call this questionnaire as lymphatic failure specific quality of life questionnaire, LFSQ we call. We use this tool to assess the quality of life change of all these patients. Now, this is very important for WHO. The WHO says what we want in the treatment of lymphatic failures is changing the quality of life of patients. And WHO uses its tool called WODAS. WHO WODAS. So that's a little complicated than what we are using. So then we used the LSQ. So the Northeastern American University decided to know which is the best tool. Whether LSQ is better or WHO is better.
Okay.
Or there's another tool called DLQI, Dermatology Life Quality Index. So these are the most, at that time, WHO's tool and DLQI was very popular.
Okay.
Now also it's popular.
Okay.
For lymphedema, everybody used these 2 tools.
Okay.
So we said this is not the tool it doesn't really reflect our patients' quality. So we developed a new tool. So the American University said we want to test it. Okay. We said okay, you test it. No problem. Then there is a requirement of the permission from the WHO to test it. If any tool developed by WHO, it has to be validated. Then it requests permission from the WHO because WHO is the highest standard.
Okay.
So somebody is saying that we want to validate your tool it's not easy. So So they got the permission from WHO to say that they can use the tool.
Okay.
They can compare it with other tools. So they got the permission. And they also got the permission, university got the permission from DLQA people group, which is in the UK. And of course, we gave our permission. And they went to the field, they tested it, and they statistically tested it. They used several parameters to test it. Then they proved.
Okay.
And they published
Okay.
in the PLOS entity, that is the PLOS is a very famous open access journal published from America. In the PLOS journal, they published that LSQ,
Okay.
that's developed by us,
Okay.
with the help of the government of Kerala, is superior
Oh.
to WHO's, ODA's, and DLQ.
As a doctor, you feel content that you have been able to come out with an integrated treatment protocol for lymphedema and lymphatic filariasis. So we hope that, I mean, we in a positive perspective, we see that you could be able to treat more patients and bring smiles to more suffering people out there.
With our limitations, if there's support from the CSR or the government, we can reach to many people. But now we have the plans also to expand our branches to other places.
Okay.
Where, because there seems to be a lot of need for this treatment. In two ways it's possible. We can work with the government. We can also expand our own way
Okay.
in endemic areas.
Thank you, sir. Thank you
you.
for being with us and sharing your valuable insights.
Thank you.
And all the best to IAD.
Thank you.